Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. We're going to talk about something that is very relevant, which is autism. Can you explain to us what is autism?
So there are many ways to talk about autism. So perhaps the simplest way to think about autism is as a social disability. Autism is not an immediately apparent just by looking at the child. Given a lack of interest in people and social interaction. So for example, a child does not engage in joint attention, incidental learning, which we call learning by watching, or imitation. Autism can also be explained in the unusual behaviors. So a child struggling with autism does not like change. Yeah, so that's the key point. And you easily develop unusual interest in things.
How many types of autism?
We can easily classify autisms as autism disorder, childhood autism, or infantile autism, and now autism spectrum disorder. Autism spectrum disorder, ASD, is a new diagnosis. The construct of autism has changed over the last century and modified how it described ASD. Is currently categorized by impairments in an individual's social communication as well as restricted repetitive behavior or interest.
I've seen that autism is very common lately.
If you look at the spike in the rise of autisms and the prevalence of it, there is a report by the Centers of Disease Control Center suggested that 1 out of 44 children would be diagnosed by the age of 8 beginning the year 2021. So looking at our country, Malaysia, the Health Ministry data shows 589 children aged 18 and below were diagnosed with autisms that same year in 2021. Children who are in the past may have been diagnosed with cognitive and behavioral view, but now given an appropriate assessment for ASD, the prevalence of cognitive disabilities and behavioral disorders of certain demographics seems to be decreasing, but on the other hand, the prevalence of ASD is actually increasing. Yeah.
What could be the possible causes of autism and the spike?
When we say autism is associated with genetic conditions that can include new mutations that could pass from, very interesting, old fathers. And we also have other genetic factors, we call it as epigenetic factors, which might be based on exposure to drugs, toxins and other environmental factors. For examples, we do have, but it's not scientifically proven, but we do have a lot of children diagnosed with ASDs, of which the parents are by professions working in the petroleum platforms, pest control services, because of the exposures to the various chemicals, right? And we also have other factors associated with increase in mutism that include, of course, old age parent, prematurity, and some other problems during labor and delivery.
How can early diagnosis and intervention impact the individuals with autism?
The proponents of autisms worldwide, guided very much by the American Academy of Pediatrics, they recommend that screening specifically for ASD during the 18th and 24 months of regular development surveillance. So we know, like, we have checkups, the monthly checkups or some timely checkups for infants as they were born right up to 2 years of their timeline development. And the screening tools, has been designed to be quick to administer, and these will enable practitioners to focus on the key red flags of ASD. And then from there, you lead towards further evaluation. But then over the years, interventions have been developed for children with ASD to address the core symptoms, which is the social communication and the behavioral differences. However, early intervention services for children with ASD vary depending on the child's need to address any broader developmental needs.
Thank you so much, Doctor, for the sharing today. It's very insightful, everybody. See you next time. Bye.